All right, so moving on, reproductive system. Again, I just want to get through the male system so that you have some time to do lab. And here we are. All right, so reproductive systems, female and male system. So sexual reproduction is when the sperm and the egg have to come together in order to have a baby, right? What's the kind called where you don't have to have sperm and egg come together? Asexual reproduction. And there's certain like species like slime molds and things that can just like divide apart of themselves and they don't have to have sex or whatever and be fine. We're going to talk about the male system and the female system. Notice that in both there's a lot of overlap. Secrete hormones, right? What's the male hormone? Testosterone. What are the female hormones you think of? Estrogen, progesterone. Produce gametes, right? Gametes are just a fancy name for the sperm and the egg. Ova is just another name for the egg. Facilitate fertilization. That just refers to like all the tubes and passageways that you have that are designed to bring the sperm and the egg into contact with each other. And then notice, though, there is an added responsibility for the female system. Sustain growth of the embryo and fetus, which the male thing doesn't have. It's just basically a sort of a tangential way of saying women can become pregnant and men can't, right? Women carry the baby and men don't. When we cover each system, we're going to go in the same format. We're going to start by talking about the gonads. That's where the sperm and eggs are made. Obviously it's the testes in males, the ovaries in females. That's also where the hormones are secreted. Then we'll go on and talk about the ducts. Now the ducts are the passageways that the sperm and the egg have to travel through. And you're gonna have to remember the ducts. It's a real pain in the butt in men because there's a lot of little details. And you're gonna have to trace that. If you're good at like Google Maps or something, maybe this will help you a little bit. Accessory sex glands, we'll talk about that. So like, in men, they're producing like the semen that has different functions for the sperm. We'll discuss all that stuff. And then supporting structures are basically anything that can't fit into these other three categories. They just kind of lump it into the supporting structures. Okay. In terms of medical specialties, I'm sure you know that like for women, they go see the OB/GYN, right? OB focuses on the care of women during pregnancy. Gynecology is, treating disorders of the female reproductive system. In men, there is no reproductive specialist per se in men. Instead, men have to go to like a urologist, right? Women can go to urologists too for the urinary system things, but for men, urology covers both their urinary system and their reproductive system. Anyone know the reason for that? Why don't they have a separate specialty for men dealing with like reproductive system disorders? Why is it urology? No?
Is it because the urinary system, the male reproductive system, like they both share penis?
Yes, exactly. They're both sharing a lot of the same passageways. That's absolutely right. Whereas with female, the urinary system is completely separate from the reproductive system. So, yeah, it kind of makes sense. That's exactly right. So here's the big picture. Lots to cover, but we're just going to get through the male system today. Anyone know why we do the male system first?
Men are first.
Because it's better? No, it's not better. It's because it's easier, all right? We do the male system first. The female system is tricky because you got to worry about the menstrual cycle and all the changes that happen in the menstrual cycle, and then you got to worry about how the eggs develop, but also how these things that surround the eggs called follicles develop, which makes it trickier. So we'll save that for Thursday and all these other topics. So we're just going to focus on the male system today. So again, we're going to follow in that order that I mentioned on the first slide. We'll talk about the gonads first, then we'll talk about all the ducts, then we'll talk about the sex glands, and then we'll finish off with supporting structures. So testes, that's where the sperm are made. Testes are also where the testosterone is produced. Then we discuss the ducts. Now, this is a shortened version of the ducts. The real list, the list that you should know, is even more excruciating to remember. There's a lot of learning passageways in A&P1, or excuse me, A&P2 that you didn't have in A&P1. There's a lot of like, if I was a sperm and I'm starting at point A and I'm trying to reach point B. What would be the structures in order that I cross to go from point A to point B? Or like later on, you'll be like, oh, if I were a drop of blood and I was starting in the right atrium, what would be the structures I'd cross to get to the, the left ventricle or things like this. There's a lot of that kind of junk, and this is the first that you're going to have to like learn that stuff in A&P2. Male accessory sex glands, they are making secretions that help out the sperm, basically, provide nutrition for the sperm, maybe like protect the sperm during ejaculation, different things like that. And then the male supporting structures, again, are just anything that didn't neatly, neatly fit into one of those other three categories. So the penis, scrotum, spermatic cord, they're all things that classify as supporting structures. So let's start with gonads, the testes. The testes are surrounded by a tough capsule called the tunica albuginea. What's a tunic? Yeah, or it's like a coat that covers something, right? And then anyone know what the prefix alb means? White. Means white, like albino, right? Somebody that doesn't have pigment in their skin. So tunica albuginea means like white coat, basically. And that's because that's what this thing looks like. It's a tough white coat that surrounds the outside of the testes. This is why when guys like get kicked in the balls and they're like, oh my God, my balls ruptured. They didn't really rupture, all right? Most likely, don't try it. They might have, but probably didn't. And that's because this thing's really strong. Remember from A&P1 when we did the eyeball dissection? What's the name of that white thing on the outside of the eyeball? Sclera. This is very much like the sclera. It's really strong, okay? The other thing that it does is there are little dividers that are connected to the tunica albuginea called septa, and you can see it on the diagram. So this would be the albuginea on the outside. These little things that are attached to it that work their way in, they're called the septa, and they help to organize the inside of the testes into compartments that are known as lobules. Inside of those lobules are where the seminiferous tubules are, and that's where the action is. That's where the sperm are being made, okay? And in lab today, you're gonna see microscope slides of the testes, and most of the cuts come through the area where the seminiferous tubules are. And if you can envision them, the seminiferous tubules are these small little passageways that twist and turn and fold back on themselves, and there's lots of them. So when you make a microscope slide and you look, you'll see a lot of weird sort of circular structures, okay? That's what it's gonna look like under the microscope. Each one of those is a seminiferous tubule, and inside each one of those are the cells that are going to become sperm, okay? They're in development to become sperm. So, fancy name for making sperm is spermatogenesis. What does spermato mean? It just means like sperm. What does genesis mean? Yeah, it's like creation at the beginning of something, right? From the Bible, the book of Genesis, right? That is a book in there, right? I haven't cracked it in a while. All right, anyway, so spermatogenesis, sperm formation, it starts at puberty and continues throughout a man's life. For better or for worse, men are making sperm like well into their 80s and 90s, right? You always see like some... Al Pacino today. Yeah, I was gonna say, you see some, it's usually some famous Hollywood actor that like hooks up with some young hottie, they're like 90 and then this person's like 22 or something. They're having a kid, even though he's only got like 2 years left to live in his life. It's like, why not have kids now, When does, so we won't talk about it today, but we're gonna talk about Thursday, egg formation. When does egg formation begin in a woman? Does it also begin at puberty?
No.
It begins before they're even born. Okay, and in fact, when a woman's born, she'll have a set number of eggs, and that's it. That number's never going to get higher. It'll get lower, but it'll never get higher than it was right at the point of birth. Men, it's different. Men don't run out of sperm. They do have lower sperm counts when they get older because the process isn't as efficient, but they don't run out the way that women do. In humans, it takes about 65 to 75 days for sperm to form. The hormones that get involved, we'll talk about how they work, but they include FSH and testosterone. Where does FSH come from? That comes from the anterior pituitary, and then testosterone comes from the testes itself. Now, when you're making sperm, you start with essentially a great-great-grandfather sperm. That's called a spermatogonia. And the spermatogonia, it's diploid. What does diploid mean?
Chromosomes?
Yeah, how many chromosomes? Means 46. So when you're doing spermatogenesis, you start with this great-grandfather cell, if you will, called a spermatogonia that has 46 chromosomes. And that cell, as it develops though, you eventually have to become a mature sperm, which is called a spermatozoa. A spermatozoa is haploid. How many chromosomes does haploid mean? 23. So you have to reduce the chromosome number. So that's why these cells are going to have to undergo meiosis. If you remember from AP1, meiosis is a type of cell division where the number of chromosomes gets reduced. Okay? This is going to happen in the tubules. Specifically, the process works from outside to in. So if you look on the edges of the seminiferous tubule, that's where you'll find like the spermatogonia. So here's a tubule. Around the edges are the spermatogonia. As they develop more, they move their way towards the middle so that by the time they're in the middle, hopefully they will then be a mature sperm, a spermatozoa. Now I'm going to talk in more detail about that. What I'm going to do on this next picture is I'm going to show you basically a super duper close-up of like one section of the wall of a seminiferous tubule to kind of explain what's happening. So here's a close-up of just the wall of the seminiferous tubule. Notice, like I said, it moves from the outer area, that's where you have like the great-grandfather sperm, towards the middle, where you eventually have the mature spermatozoa. Okay? So the spermatogonia, it's, like I said, it's diploid, or the way of abbreviating that is 2N. Don't be hung up. Spermatogonium is just the singular. Spermatogonia is plural, spermatogonium is singular. Don't get hung up on that. You start with this guy, the grandfather. It's got 46 chromosomes. Now, each day, some of those spermatogonia are going to follow this pathway and eventually become these mature sperm. And I'll talk about that in a second. But before I talk about that, I just want to tell you, I want to explain again why men don't run out of sperm when they get older. And the reason for that has to do with this little arrow going from here to there, and that word mitosis. Spermatogonia are constantly undergoing mitosis. Mitosis is a way you make exact copies of cells. You don't run out of your pool of spermatogonia because they're constantly undergoing mitosis. Okay? Now, as you get older, they may not be as good at mitosis as they were when you're in your 20s or something like that. So yes, you will have lower sperm counts, but you won't have absent sperm usually, right? Anyway, let's talk about what's going on here though. So the first step in making a sperm is emitting your sperm. Now the first step in making a sperm is differentiating. And what that means is you do some internal changes, okay? You're not dividing yet, you're just, I don't know, maybe you're making some more mitochondria, you're changing things up internally, and when you do that, the name changes. There's a lot of stupid names you're going to have to memorize. I will tell you, I forgot to tell the class this morning this, that I will tell you that a lot of these names, remember them because they're going to use the same format when we talk about egg formation on Thursday. Anyway, when that spermatogonia makes some internal changes, it's then referred to as a primary spermatocyte. It's still 2N. It's still got 46 chromosomes. It hasn't divided yet. It's just done some internal changes. That primary spermatocyte is what is going to enter into meiosis, okay? And if you remember with meiosis from AP1, there are two stages to meiosis. Or two rounds of meiosis. There's meiosis 1 and meiosis 2. With meiosis 1, you're going from one 46 chromosome cell into two 23 chromosome cells. And when that happens, unfortunately, somebody again thought it was a good idea to change the name. So after you finish meiosis 1, you now refer to these as secondary spermatocytes. And then they're going to undergo meiosis 2. And when you've done that, you've now got these 4 cells that are referred to as spermatids, each of which has 23 chromosomes. Now, somebody in the class this morning asked this, but I'll ask you guys, are these 4 spermatids, are they the same or are they different from each other? Genetically speaking, like DNA-wise. I hear some saying. No, they're different from each other. Genetically, they each have 23 chromosomes, but the exact type of gene that they have, like long blue eyes or brown eyes or that kind of thing, those are going to be different, okay? And that's a good thing, because if they were all the same, that would mean, like, you know, all your brothers and sisters look, you all are basically clones, right? So they will be different from each other. There's a process that you may or may not remember called crossing over, where during meiosis, some of the DNA gets swapped between the man's chromosomes and the woman's chromosomes and things like that. So they are going to be genetically different from each other, okay? But they're each going to have 23 chromosomes. Now, notice that they don't really look like sperm yet. They still have to undergo like some shape changes. They've got the right number of chromosomes now, but they got to undergo some shape changes. And that process is referred to as spermiogenesis. They essentially have to like grow their tail, and they also notice that when they're first formed, they're actually connected up by these little things called cytoplasmic bridges. So they have to separate those, grow their tail. They got to make their head much more streamlined so that why is it important that they're streamlined? Yeah, they gotta swim a long way, right? So they gotta be like as efficient as possible. So they gotta make some shape changes to become the mature sperm. So that's kind of the big picture. You start with one spermatogonia, it becomes a primary spermatocyte, it undergoes meiosis, and by the time you're done with the whole thing, you'll get 4 mature sperm that are all capable of participating in fertilization. That's going to be different from what we talked about with the egg on Thursday. With the egg, you start with something called a oogonia. It then becomes a primary oocyte. When it divides, it becomes a secondary oocyte. And then you got ootids and all this other stuff. But the difference with egg formation has to do with how the cytoplasm gets divided at each of these steps. With sperm, the cytoplasm are divided equally, so you get 4 sperm that are the same size. With meiosis with the egg, as you'll see on Thursday, it's not an equal division, so you end up getting 3 very small eggs, if you will, that are called polar bodies, and then you get 1 really large egg that we call the oocyte. Okay, just put that in the back of your mind. It'll come up on Thursday, but I just want to give you a heads up. Any questions about spermatogenesis? All right, the good thing about spermatogenesis, or why it's easier than oogenesis, is that you can just focus on the sperm and how they develop. When we talk about oogenesis on Thursday, you got to look at how the egg develops, but then you also have to look at how this thing that surrounds the egg called the follicle develops. And it makes it trickier, and especially the names that they use for different stages of the follicle or different stages of the egg, it just makes it challenging. All right, so spermatozoa, that's the name for your mature sperm. I think everybody has a good idea what a mature sperm looks like. Kind of like this guy. 2 parts to it, the head and the tail. The head is where the nucleus is. It's going to have 23 chromosomes in it if everything went according to plan. By the way, sometimes things don't go according to plan during meiosis, and you may have a sperm that has more or less than 23. Same thing with the egg. Sometimes meiosis doesn't go right with the egg, and you end up having an egg that has more or less than 23. If you're unlucky enough to then have that sperm or that egg actually get fertilized, that's how you wind up with embryos that have either too many or too few chromosomes, like trisomy 21, Down syndrome, okay? The problem with that is you got unlucky and you had a sperm or an egg with an abnormally high number of chromosomes and then got fertilized, and that, we'll talk about that more in chapter 29, but I just wanted to throw that out right now. Sitting on top of the nucleus is the thing that looks like a little hat called the acrosome. And the acrosome is super important because it has powerful enzymes in it that help the sperm break through the layers that surround the egg. When the egg gets ovulated with each month, the egg's not just sitting there all by itself. It's got some other layers that are stuck to it, other layers of cells kind of protecting that egg. And in order for the sperm to fertilize the egg, it has to break through all those other layers. And to help it do that is this acrosome. This acrosome will rupture, release those powerful enzymes, and that will help to eat the way through the different layers. Okay. The main, or the longest part then is going to be the tail. The tail is subdivided in the neck, middle piece, principal piece, etc. The middle piece is kind of interesting. If you could look under a high enough power microscope, like an electron microscope, not the microscopes we have in class, but like an electron microscope, it's going to look like it has stripes on it, okay? And the reason it looks that way is because it's filled up with mitochondria, and in order to fill as many mitochondria in as possible, they have to arrange them kind of in a spiral pattern. So it makes this look like it has stripes in that middle piece. Why are there so many mitochondria? Why do you need so many mitochondria? For energy, right? To do that swimming. I mean, these things are super duper tiny, right? And they gotta go a hell of a long way after they get, ejaculated into the female system. They gotta swim a hell of a long way. So they need a lot of energy. But, you don't wanna make them big and bulky because then it's harder for them to swim. So you gotta figure out some way to pack those mitochondria in, but still keep it sort of streamlined, right? Now, that's what kind of a normal sperm looks like. Not all sperm look that way. Here is a picture. You don't have to draw. I don't think I gave you this slide, but this is just a picture of some abnormal sperm, okay? So when a guy is infertile, when a guy can't have kids, there's a lot of different reasons why. One reason is that they may have normal sperm, but the count is just not high enough, and I'll talk about that in a second. But they could also potentially have abnormally shaped sperm, like you see on this diagram here. So, this is like a good size one, right? Seems reasonable. This is just, look how big that is. That's gonna be hard to swim, right? That's just like bad. This is like embarrassingly small. No one wants that. It's just, sorry. And this one just doesn't know where to go. Honestly, this seems like it would kick ass. This is like putting 2 outboard motors in a boat that usually just has one, right? Doesn't that seem like that would be awesome? I don't know. Same with this one. This one's like, boop, it's like poking through a balloon, right? It seems like that would be awesome, but apparently, I don't know. They don't like. No one likes the rough head or the abnormal middle piece. That looks like a goldfish I had with their spine. It just looks bad. So anyway, that's the possible weird sperm that you can have.
So you can't have kids if you have any of those sperm.
Well, no, you're okay. No, okay. So first of all, I guess it depends on how severe the problem is. I'm not gonna, you may not have to have completely normal sperm, but some of those ones I'm sure are like, yeah, they're not gonna probably participate pretty well. So. Yeah, I don't, it's a good question. I mean, I don't know if there's ever been a study to show that, like, hey, maybe if you do have 2 tails, like, are those guys, like, super fertile? Like, I don't know if that's ever been, like, studied before. Like, don't sleep with that guy, you're going to get pregnant for sure. I don't know. So, now we got to talk about hormones, which is why we did this chapter after we did chapter 18. So, hormones control spermatogenesis. The question, though, is, remember, guys don't make sperm until puberty. What exactly happens at puberty to trigger that? The short answer is they don't know. But something causes GnRH, gonadotropin-releasing hormone, to be released from the hypothalamus. That's going to go down through that little blood vessel network. Anyone remember the name of that blood vessel network? Hypophyseal portal system, right? That's the little blood vessel. GnRH is going to go through that little blood vessel network down to the anterior pituitary and cause the anterior pituitary to release LH and FSH, all right? Luteinizing hormone and follicle stimulating hormone. Now remember, these 2 hormones, guys have them, okay? But their names are based on what they do in women. So the name isn't really going to help you so much for men, but let me tell you what they do and you're just going to have to memorize it. So LH goes to a type of cell that's in the testes called a Leydig cell. Now, a Leydig cell is located outside of the seminiferous tubules. Leydig cells are the ones that make testosterone. Testosterone is super important for spermatogenesis, especially the final step. So if you go back to this diagram, notice, it's maybe a little hard for you guys to see, but each one of these is a seminiferous tubule, and sitting outside or in between the tubules, that's where you find the Leydig cells. So the Leydig cells are not in the tubules themselves. And this is important for me to explain something here. I'm going to draw a picture of it. So here's a seminiferous tubule. Okay? Inside of the seminiferous tubule are the cells that are going to become sperm. So you'll have like the spermatogonia sort of sitting out here, and then as you move towards the middle, it'll be more like primary spermatocytes, right? Till eventually, by the time you get in the very middle, you'll have like your mature sperm, hopefully, right? The Leydig cells, though, they're sitting over outside. They're not inside the tubule. Now, LH, actually, let me go back to the picture. Whoops. So, LH coming from the anterior pituitary is going to make the Leydig cells produce testosterone. Going back to chapter 18, what type of a hormone is testosterone? Lipid soluble or water soluble? Lipid soluble. Remember, it's a steroid hormone, so it's lipid soluble. Because testosterone is lipid soluble, these guys produce the testosterone. And because it's lipid soluble, it has no problem getting through the membrane that surrounds the outside of the seminiferous tubule. So this testosterone, some of it will go into the tubule where the sperm are developing. And that's perfect. That's what we want to have happen, because you need high testosterone levels inside of this. Sorry, I don't want to sit down. You need high testosterone levels inside of here so that spermatogenesis happens. Okay. Now, the problem is that just as easy as it is for testosterone to go inside of the tubule, it could immediately just go right back out again. And you don't want that to happen. You want testosterone to build up inside of the tubule. So how do you solve that problem? The answer is listed on the border there. There's another set of cells that are inside of the tubules called Sertoli cells. By the way, these guys go by some different names. Leydig cells are sometimes referred to as interstitial cells. I'll leave this picture up here. Interstitial cells. And Sertoli cells are sometimes called nurse cells or sustenacular cells. Just different names. Anyway, FSH, which also comes from the anterior pituitary, comes down and it causes the Sertoli cells to produce a chemical called androgen binding protein, or ABP. And the name kind of tells you what it does. Androgen means like male sex hormone, so it basically means testosterone, and then binding protein means that it will bind to, it's a protein that will bind to testosterone. So this ABP attaches to the testosterone, and once it does that, it locks the testosterone in and traps it so that it doesn't move right back out. And by doing that, it's allowing testosterone levels to get high inside of that tubule to make the sperm happy so they can develop. Does that make sense? Yes? I like to keep you on your toes. I'll throw anything out. Yeah. You can, here's the deal. And I'm pretty good with this. Like, you can come up, I'll keep this on board. You can come up like during a lecture exam and ask me a question like, is that the same thing as whatever? And I will usually answer that. I'm the same with like abbreviations. Like, if there's an abbreviation and you don't know what it is, you can come up and ask me and I'll tell you, right? I told my other class knows this, but like one year, I didn't tell students.
ACH.
I didn't tell students what ACH meant. It's supposed to mean acetylcholine, and I didn't tell them. And this girl came up during the final exam, and she's like, Dr. Brown, what's She's like, what are you talking about? She's like, what's And then she showed me, I'm like, oh, that's acetylcholine. So you can come up and ask me, and I'll tell you like what these things mean. All right. Anyway, that's what's going on. Again, the whole point of the ABP is to lock the testosterone in so levels can get high. All right. This is a diagram, their diagram, just kind of showing you the same thing. Again, something's happening at puberty. They're still not exactly sure what, but something happens in puberty that causes the hypothalamus to release GnRH. When that happens, GnRH causes FSH and LH to be released. LH is going to go to the Leydig cells. They're going to make testosterone. FSH is going to go to the Sertoli cells. They're going to make ABP. The testosterone that then gets inside of the tubules will attach to the ABP, and then it'll be trapped. It won't be able to get back out, and that's a good thing because then the testosterone levels can get nice and high in the tubules, and that'll allow the spermatogenesis to take place. Okay. Once you've reached enough sperm formation for the day, the Sertoli cells can release inhibin as a way to kind of talk back and shut down things from above, or testosterone levels themselves, as they start to get high, they will go back and they will stop things from above. So there is a negative feedback system kind of built in here to shut things off once you get up to high enough levels of spermatogenesis for the day. The other thing to know about testosterone, it's not just there for spermatogenesis. There are other effects to testosterone. Testosterone can be converted into a form called DHT, which then has these effects, and I'll talk about this on the next slide. So other stuff that testosterone does, prenatal development. Testosterone is super important if you're genetically a male. What are the sex chromosomes that males should have? XY. If you're XY, when you're at 8 weeks stage of an embryo, when you've reached 8 weeks as an embryo, if you're XY, there should be a natural surge of testosterone levels that happens. We'll talk about this in chapter 29. But when that surge happens in testosterone, it causes the male external genitals to develop, and it basically leads your body down the pathway to becoming a male. Okay? So that testosterone surge during the embryonic stage, 8 weeks, is super important. What's interesting is it's just a surge. It just goes up, and then after that, the genitals have kind of developed, the testosterone levels actually go down, and they stay down through the rest of the embryonic and fetal period. They stay down throughout childhood, and then when you reach puberty, then they go back up again. But there's kind of that quiet period after they made their surge at 8 weeks. This leads to a lot of, what's the word I want to use? I don't want to say interesting, maybe that sounds too cold, but it leads to a lot of strange possible sex disorders that people see. There are cases where you have a baby that's XY. They've got an XY, genotype, so they're genetically a male, but for whatever reason, they don't get that surge of testosterone at 8 weeks, so their genitals follow more of a female pathway. What's that?
So they have both.
So kind of they have both, or they're kind of in between, right? Both, yeah, and that can happen.
Are there surgeries while they're equally?
Oh, you mean like in utero are there surgeries?
Like that, or like?
What do they do in that
What does
situation?
that mean for them? Because anything is
Wow,
right.
you guys are like throwing. I was just going to tell you this and kind of let the chips fall where they may, but I'm not sure of all the ramifications. I mean, yeah, they're going to have to undergo a lot of counseling and then kind of discuss. I guess just discuss which route they want to go. I mean, I don't know. It's a good. I don't know all that's going to be involved. I don't think there's anything that they do in utero with any surgery. There are in utero surgeries that they do for other conditions now, where before the baby's been born, they'll do an operation. But I don't think this is one of those things. Yeah.
Well, it's probably super uncommon.
I was gonna say, it's not very frequent.
No, it's not very frequent. I can't give you the exact numbers. I'm trying to think if it's called it might be called testicular feminization syndrome or something like that, I believe. I don't know, don't quote me on that. But I believe it can also go the opposite way too. You could have a baby that's genetically a female, XX, and for whatever reason, there's that surge of testosterone at 8 weeks, so that then leads her down the male sort of pathway. So anyway, other stuff that testosterone does, like I said, it's gonna peak up, it's gonna be quiet kind of throughout the rest of pregnancy, the rest of childhood, but then it's gonna rise again at puberty, and that should lead to the development of male sex characteristics, further enlargement of the male sex organs, promotion of secondary sex characteristics, the male hair pattern, lower voice, narrow hips, all that stuff. That's all linked to the testosterone. Testosterone is actually present in men and women if you remember, did anyone remember where was the source of testosterone in women? Not the reproductive organs, but where could you get a little bit of testosterone in women? I'll give you a hint. It's a gland. It sits on top of the kidneys. Adrenals. Remember the zona reticularis, right? That makes weak androgens, right? So you do have some testosterone in women. Also remember that testosterone and estrogens, they're very similar chemically. They're both based on cholesterol. It's really not that tough for your body to switch between the two. So, and anyway, in both sexes, testosterone is thought to play a role in sex drive. Testosterone, as you probably know, is also a well-known anabolic hormone. There are, examples of people abusing, synthetic forms of testosterone for weight building and things like that. It's a stimulant of protein synthesis. So the more testosterone on board, the easier it is to grow muscle mass.
That's actually what bodybuilders are using now. Instead of using like traditional steroids, they're using like testosterone.
You heard, right? You sound like you know so much information. I'm just kidding. Allegedly, yeah. My friend, yeah.
That's what they said.
No, I know. I know. That's like the real deal. Yeah. All right. Let's talk about. We're gonna shift gears now. We're gonna talk about the passageways, and this is where there's a lot of like memorization and minutia to go through. But let me just run you through this. So you make the sperm in the seminiferous tubules. Those are those coiled little tubules that are there, right? After they're made there, they're carried towards the middle of the testes by following these passageways called the straight tubules. So these are the straight tubules that carry the sperm to the middle. There's a kind of a pooling area or a collecting area in the middle of the testes called the rete testis. So all the sperm show up there. Then the sperm are going to leave the testes using what are called efferent ducts. Okay, these would be the efferent ducts. Anyone remember the words afferent and efferent from A&P 1? Yeah, like afferent neuron and efferent. What did afferent mean?
Like go up or go down.
Afferent means to go toward something, and then efferent means to go away from it. So like afferent neurons was another name for sensory neurons because they carry signals toward the central nervous system, and efferent neurons was another name for motor neurons because they carry the signal away. So anytime you see the word afferent, it means toward something, and efferent means away from. So in this case, the efferent ducts are taking the sperm away from the testes. And they're bringing it to this highly coiled tubule that sits on top called the epididymis. Now, the epididymis is important for a couple of things. Number one, it's the place where sperm learn how to swim, okay? Structurally sperm are like normal after they leave the seminiferous tubules. So they look like your regular old sperm, but then if you like ask these guys, like, hey, can you just like swim a few laps for me? They'd be like, what? Like they couldn't do it. Like it would be too tough, right? They just give up. Like I guess swimming's not your sport, right? Swim, we gotta send you to. So yeah, there you go. The epididymis is like swim school. So they learn how to swim when they're in the epididymis. They also learn the ability to fertilize an ovum. I don't know. Somebody's giving a coach is giving a pep talk about how to do it. I don't know. Learning all this stuff while they're doing it. The other thing about the epididymis is it's a storage spot. And sperm can be stored in the epididymis for like, I think what I've read is usually like 3 months or 90 days is kind of the maximum storage period. If you don't ejaculate for 3 months, guys, don't get depressed or anything. You don't ejaculate for 3 months, sperm die. They die inside the epididymis. And as you'll see under the microscope today, there are special little cilia on the cells that line the epididymis that are there to help absorb the dead sperm parts. Okay? They're called stereocilia. You'll see it under the microscope, but that's again to help with the absorption of the sperm that die off there. Okay? Anyway, after the epididymis, you then travel through this long passageway called the vas deferens. The vas deferens leaves the scrotum. It goes up and over the pubic symphysis, right? That's that cartilage that holds your hip bones together. It goes around the side of the bladder. That's the bladder there. It goes over this tube. Anyone know what that tube is that it's going over? think you had it. What did you say?
You actually pronounce it wrong.
Yeah, ureter. Is that what you're trying to say? Yeah. Yeah. This is called the ureter, and it's part of your urinary system. It's going to connect up to your kidneys. So your kidneys would be up here, and then they connect to your bladder using this ureter. Anyway, the vas deferens goes over top of the ureter. It comes down the back side of the bladder. It's going to meet up with one of your glands that we'll talk about in a second called the seminal vesicle right there. As soon as the two of them meet up, you get this very short passageway called the ejaculatory duct. The ejaculatory duct travels through this is the prostate gland here. It travels through the prostate, and then it connects up with the urethra. This is the urethra here. The urethra is divided into 3 parts. So this entire thing, starting here until you get out, that's all urethra. But you're going to need to know the separate parts. So while you're going through the prostate, that's called the prostatic urethra. Then, as you go through what are called the pelvic floor muscles, it's very short, but that's called the intermediate or the membranous urethra. And then the rest of it is inside the penis, and they call that the penile urethra or the spongy urethra. Okay? So that's it. That's the passageway that you're going to have to basically memorize that. So let's talk about semen then. So semen is the combination of the sperm and seminal fluid. Volume of semen in a typical ejaculate, 2.5 to 5 milliliters with 50 to 150 million sperm per milliliter. How big is a milliliter? Yeah, it's basically a cubic centimeter. So take a centimeter and make a box out of it, and inside that little box, you should have somewhere between 50 and 150 million sperm, right? That's a ton. If the magic number seems to be 20 million, you want to be above that number. If you have less than 20 million sperm per milliliter, there's a very good chance that the guy's going to be infertile and not able to have kids. And you may be saying, well, God, I mean, even if you had like 15 million, that seems like a hell of a lot of sperm, right? 15 million sperm. Why does it have to be so high?
A lot of them.
Yeah, a lot of them are not going to make it. A lot of them are going to die off in the female reproductive tract. Okay, it's a very inhospitable environment there. It's acidic. They cop an attitude sometimes. It's bitchy. Like it's not a good place to be. The guys are coming in, they're friendly, and it's just like
I don't think so.
but there's a lot of death going on. So you need high numbers so that you have some of the sperm actually reach the egg. Let me ask you a different question. How many sperm will fertilize the egg? 1. How many sperm actually need to reach the egg? Any guess there? How many?
100.
About 100. And that's because, why? Why? So if only 1 sperm is actually going to fertilize the egg, why do you need like 100 sperm actually reach in the area?
It's tough to get inside.
It's tough to get inside, breaking through those layers that surround the egg, right? You need a lot of enzyme power to break through those layers. Remember, they all have those hats on. All these idiot sperm are showing up with these hats on, and they got these enzymes in there. Well, the enzymes from 1 sperm is not strong enough to eat through all those layers and get to the egg. However, the enzyme from 100 or more sperm, the combined enzyme power, is thought to be enough to then allow the breakthrough.
So if you're the smart one, you stay behind, let the other one's the hard work, and
Right.
then you just go up.
Yeah,
Okay.
yeah, that's exactly it. Yeah. That applies to like things in life too. Just anytime somebody asks you to work, just kind of sit back a little bit. Like, let's
I have a question, Professor.
Yeah.
So in those 100 sperm, would there be a position where like there will be all of the like types of sperm that you showed us? Like would it be like a big one, small, or like shaped, or?
I mean, there could be. I mean, most people are going to have a hell of a lot of normal-looking sperm. Those were sort of the abnormalities,
Okay.
Yeah, I mean, there could be an odd one thrown in here or there, but yeah, most of them are going to look normal. Yeah.
Get that far?
To get that far? I don't know if people have ever done enough studies. Like I said, I think the one with the 2 tails would probably have an advantage, honestly, but I don't know.
Oh yeah, we'll go faster.
Yeah. Anyway, so let's talk about some of the others, the chemicals that are in the seminal fluid, and the chemicals are coming from those 3 glands: the seminal vesicles, the prostate, the bulbourethral gland. This is a posterior view showing you these different glands. So there's going to be a left and a right seminal vesicle. Then you have one prostate, which is right in the midline. and then you're going to have two really tiny bulbourethral glands or Cowper's glands. And the question is, what do they make? So most of the seminal fluid's coming from the seminal vesicles. They make up like 60% of the fluid, and the fluid is alkaline. What does that mean? It's basic, and it's important that it's kind of basic because the female reproductive system is usually slightly acidic, so this helps to kind of neutralize the environment. The other thing that you have there is lots of fructose. Fructose is an isomer of glucose. It can be used for energy. Again, you know, the sperm need a lot of energy, so this is helping feed the sperm, okay? Prostate comes next. The prostate contributes about 25%. Now the prostatic fluid is actually slightly acidic because it contains a substance called citric acid. Citric acid, we're going to talk about like probably in May, because we discussed the last chapter of the book. We talk about, maybe you heard of the Krebs cycle? Anyone heard of the Krebs cycle? Anyone know the other name for the Krebs cycle? It's called the citric acid cycle. Citric acid is something that can be used for energy. So you've got basically two things that can be used for energy. You got the fructose coming from there, you got the citric acid coming from there, that can all be used for energy. The prostate also makes some enzymes that can help the sperm kind of eat their way through the secretions and things, etc. in the female tract, more proteolytic enzymes and things, in addition to what's going to be inside their acrosome. These are some extra enzymes that can help. This one is pretty famous, PSA. Anyone know what PSA stands for? Yeah, that's exactly right. PSA is the test they use to test for prostate cancer. Does anyone know what PSA stands for? It stands for prostate-specific antigen, okay? And PSA is put into the seminal fluid. However, in all guys, some of that PSA ends up getting into our blood. So if you take a blood sample of a guy and test it, you will find a little bit of PSA. But the numbers should be fairly low that get into the blood. If you test a guy and they're above a certain range, it's a suggestion that they might have prostate cancer. So you can use PSA as a potential screening test for prostate cancer. The only thing you got to be aware of and careful with is that there are other conditions of the prostate that can give you high PSA levels. So it doesn't necessarily mean cancer if you see a high PSA level. There's a much more common condition called benign prostatic hyperplasia that can also give you an elevated PSA. So it's something you need to be a little bit careful of. You know, obviously you wouldn't just say, based on a PSA, you wouldn't just say someone's got cancer. You'd have to do like a biopsy and do other things like that. You can also use PSA to monitor men that have had prostate cancer and are undergoing treatment. Ideally, after you treat a guy, either by radiotherapy or chemotherapy or surgery, their PSA levels in their blood after treatment should go down to normal. You follow the guy over time, you know, every couple of months or every year or whatever, and if all of a sudden you see the PSA level going back up, what does that suggest? The cancer came back, right? So you'll hear about it in the real world once you get out and start seeing real patients and stuff like that. Bulbourethral gland is the last one. It's tiny. It makes an alkaline mucus that again helps to neutralize the acidic pH. The mucus itself almost acts like a shock absorber for the sperm as they're being ejaculated. It's almost like airbags on a car. When the sperm are being ejaculated, as they're coming out the penis, how many miles per hour are they traveling? Yeah, I don't know. I wish I did know. It's probably someplace I could find it. I don't know. But anyway, look that up. That seems like something you would know. Look that up. Anyway, they're coming out fast, and the mucus that's in there kind of acts like, you know, airbags, if you will, to sort of protect the sperm from damage. All right, last part are the supporting structures. Actually, wait, before I do that, I just want to give you another type of PSA. This is going to be a public service announcement, not a prostate-specific antigen. So my other PSA is, how do you check the prostate for prostate cancer? Do what?
They go up to the index.
Yeah.
Make you cough.
Oh, they made you cough?
They make the resident, no, they ask
I don't know,
the
tell me.
patient to cough and then they see if
I have no idea. Tell me. Literally.
No. They don't. If they make them cough, that's a different thing, and I can tell you what that's for. They shouldn't make them cough, but they do. You were right. They do go up through the anus with the finger, right? All right. Now I'm going to tell you some information that you're going to want to write this down. Hold on. Has anyone in here ever done a prostate exam on anybody? Like professionally, not just recreationally? So there's a way to do this, okay? I have done it many times. I'm not embarrassed, I've done it. And first of all, when you do a prostate exam on someone, you know, obviously put a glove on, okay, step one. Make sure there's plenty of lube, okay, on your finger. And you're gonna have them bend over, and they're gonna be kind of like this, and you're basically putting your finger in like this as they're bending over. If you put it in through the rectum, there's the rectum, and then you push forward with your finger, there's the prostate. And by pushing forward and kind of moving a little bit to the left and a little bit to the right, you can feel pretty much all of the prostate except for the most anterior part. That's the only part that you really can't feel. But otherwise, you can kind of push to the left, to the right, and you can get a good sense of what the prostate feels like. I'm like, okay, but I could probably figure that already. So this is the part you want to write down. What's the prostate supposed to feel like? And here's what you're going to do. I want you to take your thumb, and I want you to squeeze your thumb against your middle finger like this. Okay, now don't get worried. You don't do this once your hand's in the guy, all right? You're doing this before you go into the room. Okay? This is outside the exam room before you see the guy, just to give yourself an idea of what you're feeling for. Okay? So you do this, and then you feel this here with the other hand. That's what a normal prostate should feel like. It's kind of rubbery. It's firm, but it's rubbery. It'll give a little bit. Okay? That's normal. If you feel this, that's what that problem called BPH feels like. That's benign prostatic hypertrophy, BPH. It's a normal condition in older men. It's like a big, boggy, spongy prostate. It's not cancer. It's like 80% of men over 75 have this condition, but that's what that feels like, soft and super spongy. If you feel this, that's prostate cancer. Okay, that's how hard it is, feeling the knuckle. You're welcome. All right, so. I also saw on the internet, this is also something you can do to like test steak, like how the steak's well done or medium rare or something. So, yeah, have you seen that too? Yeah. So it works for both. Yeah. All right. Next, we have the supporting structure. So the scrotum and the spermatic cord. So the scrotum is, literally the sac that the testes are inside. Why are the testes inside the scrotum? Why aren't they just inside of your body cavity like the ovaries are? Temperature, all right? For whatever reason, sperm like a cooler temperature for spermatogenesis. They like a temperature that's 2 to 3 degrees centigrade below your core temperature. What's the normal value for your core temperature in Celsius? No, it's just 37. Yeah, 37 degrees Celsius is considered your normal core. So these guys like it down around 34, 35. They like it a little bit cooler. So in order to get that temp, you have them outside your body. However, there's a difference between being like a little bit chilly and then being like absolutely freezing, right? You don't want it to be too cold, right? So you have these muscles that help adjust the height of the testes, which then will adjust the temperature of the testes. And when let me explain the muscles first. So the first is dartos, and I don't think it's labeled here, but you can kind of see it. Dartos is a very thin muscle that's right underneath the skin of the scrotum. And then you've got this other muscle that actually comes down from your abdominal wall and surrounds the testes, and that's called the cremaster muscle. And when these muscles contract, they pull the testes up closer to the body wall, and that will heat the testes up. That will make them warmer, okay? So, if it's freezing, I don't know, today was the day you decided to go out in, naked in your yard in February in Fairfield County, Connecticut, and those guys are gonna be like, and they're like lifting up to try to get those testes as close to your body wall as possible because they're gonna be too cold otherwise. Likewise, when do you think these two muscles would relax? When it's hot, right? When it's hot, you don't want the testes to get any hotter than they already are. If you pull those testes close to your body wall, that's going to just warm them up further. So you want to keep them as far away from your body as possible so these two muscles will relax under that situation. Okay. Another public service announcement for guys. You're a young guy, you should be checking your testes like once a month for lumps or bumps or anything. Testicular cancer is like a real thing, and you know, you can die from it and stuff like that, but you can catch it early. And the recommendation is, anyone know? Anyone, where should you be, where is it recommended that you do like a testicular exam on yourself?
The shower.
The shower. What kind of shower?
A warm.
Yeah, warm shower. That's what they recommend because that will, you know, cause those muscles to relax and you'll get a better exam than if you like go outside naked and there's snow around and they're like the testes are jammed up and you can't get to them. So you want it to be nice and warm. All right. Another fun thing that you can try this tonight for extra credit, is a neurologic test that they do that involves this muscle. It's called the cremaster reflex. Is anyone familiar with the cremaster reflex? Oh, you're gonna want to try this tonight. So what you want to do to make it look legit, it helps if you have like an actual reflex hammer like this. If you don't, you can use like a butter knife or something. You don't want to use anything sharper than a butter knife.
What are we testing?
Well, you'll see. First of all, I should start by saying this. For guys, you can't do this on yourself. I know there's some weirdos in here that maybe we're going to try this. You can't do this on yourself, guys. All right? But what happens with the cremaster reflex, and this is not a joke. This is a real reflex that like neurologists will test on guys if they think they've had a spinal cord injury or things like that. They will do this. And with the cremaster reflex, you take, you know, something that's not too sharp but has a little bit of an edge to it, and you're supposed to scrape on, have them stand up, and you're supposed to scrape along the inside of the thigh on both sides. Does anyone know what the normal, the normal response is if you scrape along the inside of the thigh? What should you see? You should see the testicle on the ipsilateral side go upward and rise up. So you scrape here, right? Scrape over here, it goes up on that side.
It's like a magic trick.
It's like a magic trick. So, party trick. But that's a real thing that they do. That's called the cremaster reflex. It's to test for some of the nerves that are going to the area, etc. Spermatic cord. The spermatic cord is this structure that you see here. It kind of acts like a tether that anchors the testes to the abdominal wall. So this is the spermatic cord coming down here. The outside of the spermatic cord is formed by that cremaster muscle that I mentioned. So there's the cremaster muscle. If you kind of cut that away, then you'll see all these important other structures that are inside. The vas deferens is there, the testicular arteries and veins, some branches of your sympathetic and parasympathetic nervous system are in there, lymphatic vessels, etc. Now the spermatic cord actually travels through a little passageway that's in your abdominal muscles called the inguinal canal. You may remember from A&P1, you basically have three muscles that form your abdominal wall. The deepest one is the transversus abdominis, then you have an internal oblique, and then you have an external oblique. But down kind of by where your lower pelvis is, there's a little opening in those three muscles, and that's called the inguinal canal. The spermatic cord passes through that inguinal canal, and then, you know, it connects to the testes that's down there. All right. Women also have an inguinal canal. They don't have a spermatic cord, but instead they've got something called the round ligament that travels through there. Okay. The other reason, anyone know of any problems that people can get with the inguinal canal? What is it? Hernias. So a hernia is when something is pushing through a barrier that it shouldn't. When something is in a location where it shouldn't be because it broke through some kind of a barrier. And when somebody says they have a hernia, if they don't say anything else like, oh, I've got a hernia, they usually mean they have an inguinal hernia, and that's when other stuff is coming through that inguinal canal. So not just the spermatic cord, which should come through there, but maybe you got other stuff in your abdomen, fat tissue or something else that's actually traveling down. And depending on how much stuff actually travels down, you might see like their scrotum could be like huge, just depending on what's traveling down there. And it happens when this inguinal canal gets wider than it should be. When it's nice and narrow like that, that's fine. But when it gets a little bit bigger, other stuff can start to kind of slide next to it, and that's what happens. And you were talking about coughing. That's what they'll do for the coughing test. Is if you think somebody that might have an inguinal hernia, you have them sort of stand there. You as the examiner, you kind of push. You don't want to like jam into their testes, right? But you kind of push their testes off to the side. You put your finger up through like their scrotum, and you want to get the tip of your finger kind of where the opening of that inguinal canal is. Then you have them turn their head to the side. You have them cough. And what that'll do is that'll contract all of your abdominal muscles. That'll create pressure in your abdomen. And if you have a hernia, anything that was in there should push down, and you'll actually be able to feel it hitting your other finger as they're coughing. Okay? That's useful if it's in question, right? Sometimes it's pretty subtle whether somebody has a hernia or not. Other times it's not subtle at all. You'll look at their scrotum, and it'll be the size of like, a grapefruit or a small watermelon, and be like, I think that guy's got a hernia, right? And then and it can get crazy. Sometimes it's just like, sometimes it's just fat, but I've seen cases where you have parts of your small intestine in there, large intestine, and it can get stuck and twisted, and some people can get like a bowel obstruction from. Sorry, is this messing you up, Jess?
Yeah, it's messing me up a lot.
Yeah, just plug yours right there. No, so bad stuff. So hernias need to get fixed. And the problem is sometimes you get what's called an incarcerated hernia, where the stuff comes down and then it gets stuck there, and you can't push it back up, and that's a problem. Yeah, were you gonna say something, Dan? Oh, sorry. All right, almost done here. How many more slides do I got? Hold on a second here. Yeah, so just 2 more slides, and then I'll let you guys take your break. So the penis then, penis has the 3 parts to it: the body, the glans penis, and the root. The penis is held, or it's suspended from your abdominal wall using 2 ligaments: the fundiform ligament and the suspensory ligament. The suspensory ligament is attached to the pubic symphysis. Again, that's that piece of cartilage that holds your hip bones together. The fundiform ligament is attached to the linea alba. First of all, what did alba mean again? White. Anyone know what linea means?
White line.
It means line. So this means white line. Anyone know what the linea alba is? So, like when you have like 6-pack abs, I'm speaking theoretically, all right? When you have 6-pack abs, okay, you've got that white line down the middle that kind of separates the 6-pack in your rectus abdominis muscle. That's the linea alba. So that ligament is attaching to that white line of the rectus abdominis, and then it attaches to like the top of the penis, basically, and holds it in place. Okay. If you do a cross section on the penis, mostly what you're going to see inside is lots of erectile tissue. Okay. Once again, you have that tough white coat on the outside, the tunica albuginea, but once you get inside, all these kind of light blue areas, those are all different pieces of erectile tissue. And the way it works is there are 2 pieces of erectile tissue on the top. That's called the corpora cavernosa. And then there's one on the bottom called the corpus spongiosum. Running through the corpus spongiosum is where you actually have the urethra, the penile urethra. So you're going to see in lab today, you're going to get to look at some penis slides under the microscope. You'll see it kind of looks like a face, right? You got these 2 big eyes, right? Alien face, and then you got like that little mouth down there, okay? What is erectile tissue? Erectile tissue is basically like cavernous tissue with lots of spaces in it for blood to fill up, okay? When you have an erection, I think most guys know this, but maybe not, it's due to blood filling up this erectile tissue. And as more blood fills it up, it stretches it and it causes an erection. Okay? Did most of you guys know that? Or did any of you guys think that there was like an actual bone in there? I mean, you know the slang, right? You all know the slang. Did anyone think there was a bone in there?
I didn't think there was a bone in there, but what happens when there are instances where it breaks? What exactly is going on?
Yeah, no, it's painful to even think about it. No, they're basically tearing that tunica albuginea, and so you're kind of, it's almost like you're cutting a big blood vessel. And so if you break through that, and the penis can literally break, or almost like it is cracking. then that blood can like leak out into the skin. You can get like a big hematoma, and it just can look, yeah, really nasty and painful, obviously too. But, yeah. I don't know exactly what they do to repair that, but yeah.
You don't repair it. You don't come back from that.
One time when I was working in the ER,
How old?
they had some guy that had come in to get some abdominal X-ray for some reason. Don't ask me why. And when they do an abdominal X-ray, they usually will get the penis on the shot, so you could see this guy's penis on this abdominal X-ray. Well, at the same time, this is like a 1 in a million situation. At the same time, this like, I want to say like, I don't know, 3 or 4 year old boy had come in with a broken humerus, and some jokester in the radiology suite took his X-ray and slid it up behind this guy's penis, and it looked like there was a snap bone inside of his penis. That's the kind of hilarity that ensues when you're in the hospital. That's the kind of fun hijinks you're going to get to see.
That's fine.
Anyway, male sexual response, it's the two divisions of the autonomic nervous system. The parasympathetic does the erection part by basically increasing blood flow. So nitric oxide, which is a hormone and it's also a neurotransmitter, it's released, it dilates the arteries that go into the erectile tissue, so this erectile tissue starts filling up with blood and you get the erection. The ejaculation phase is due to the sympathetic nervous system, all right? So your body neurologically sort of has to shift gears from the parasympathetic and then to the sympathetic. During ejaculation, there's a lot of muscles that are contracting involuntarily that are propelling the semen forward. One of the most important muscles that has to contract, though, is the smooth muscle sphincter at the base of the bladder. Let me show you that on a previous picture and explain why that's. You probably. Why is that important that the muscle at the base of the bladder contracts? So that what? Not to push the penis up so much, but to make sure that the sperm doesn't what? Go backwards into the bladder. So on this diagram here, there's a muscle, this is the bladder, right? There's a muscle right here in the wall of the opening of the urethra as it comes off the bladder. That little muscle has to contract during ejaculation so that the sperm go out this way and none of the sperm try to go back up that way. And that's called, it can happen, that's called retrograde ejaculation. Some sperm. What's that? Yeah, it's a bad thing. Yeah. So that's important. There is a, I think this is the last slide. There is a memory trick for parasympathetic and sympathetic to remember which one causes erection and which one causes ejaculation. Anyone know the memory trick? Memory trick is point and shoot. Okay? Point, parasympathetic, and shoot.
That's really
You're not going to call HR me, are you, Jess?
I don't have it.
I don't mean stand up.
What's
I will
that?
always remember that now.
All right. I think that's all I have for today. Let me make sure. Yeah. Okay. Any questions about any of the mail system stuff?